Anencephaly is a severe neural tube defect where a baby is born without parts of the brain, skull and scalp. It occurs when the neural tube, which forms the brain and spinal cord, fails to close properly during early embryonic development, typically between the 3rd and 4th week of pregnancy. Babies with anencephaly cannot survive long after birth. Causes of anencephaly. The most well-established cause is insufficient folic acid, also known as vitamin B9, intake before and during early pregnancy. Folic acid is critical for proper neural tube closure. Low maternal folate levels increase the risk of neural tube defects like anencephaly and spina bifida. Genetic factors. Family history of neural tube defects or genetic mutations, for example, in genes like MTHFR that affect folate metabolism. Chromosomal abnormalities such as trisomy 18 or 13 may also play a role. Environmental and lifestyle factors can play a significant role in the development of anencephaly. Poorly controlled maternal diabetes or high BMI increases the risk. Certain medications like anti-seizure drugs such as valproic acid and carbamazepine, along with some chemotherapy agents, can also contribute. Additionally, hypothermia, which includes high fever, hot tub use or saunas during early pregnancy, is a risk factor. Exposure to toxins such as pesticides, lead, or other environmental contaminants is another contributing factor. Ethnicity and geography also influence the occurrence of anencephaly. Higher rates are observed in some populations, such as Hispanic women in the United States, and in regions with limited access to folate-rich diets or fortified foods. Now let's talk about prevention strategies. First, folic acid supplementation is crucial. All women of childbearing age should take 400 to 800 micrograms of folic acid daily, ideally starting at least 1 month before conception and continuing through the first trimester. Women at high risk, such as those with a prior NTD pregnancy, diabetes or obesity, may need 4,000 to 5,000 micrograms per day under medical supervision. Second, dietary fortification is important. Eating folate-rich foods like leafy greens, citrus fruits, beans, and fortified grains can help. Many countries, such as the United States and Canada, mandate folic acid fortification of staple foods such as flour and rice to reduce NTD rates. Third, managing pre-existing conditions is vital. Controlling blood sugar levels in diabetic women and achieving a healthy weight before pregnancy can make a big difference. Fourth, avoiding harmful exposures is essential. Limiting exposure to high heat, such as hot tubs and saunas, and environmental toxins is important. Reviewing medications with a doctor to avoid teratogenic drugs is also recommended. Fifth, genetic counseling is recommended for families with a history of NTDs to assess risks and plan for future pregnancies. Finally, prenatal screening is a valuable tool. Early pregnancy ultrasounds and maternal blood tests, such as alpha-fetoprotein screening, can detect NTDs, though prevention remains the priority. So, why does prevention matter? Up to 70% of anencephaly cases can be prevented with adequate folic acid intake. Public health initiatives promoting folate supplementation and food fortification have significantly reduced NTD rates globally. Bear in mind that not all cases of anencephaly are preventable, but proactive steps like folic acid supplementation, healthy lifestyle choices, and early prenatal care can drastically reduce risks.